Measuring blood pressure, David Rodriguez. Patients should refrain from smoking cigarettes or ingesting caffeine 30 minutes prior to blood pressure assessment. Patient quietly sits for 5 minutes with feet flat on the ground, back supported, and arms supported at heart level. The cuff, as seen here, must be the appropriate size to ensure accurate measurements. Cuff should require 80% of the upper arm. Wrap the cuff firmly around the left arm at heart level, aligning the cuff with the brachial artery. 2 fingers are placed inside the cuff to make sure it's not too tight. The stethoscope will be used to listen to the sounds of pressure. Make sure that the earpiece are pointing forward when inserted inside the ear. Make sure that the chest piece of the stethoscope is turned on to better hear the Korokov sounds. Next, the sphygmomanometer will be used to measure pressure in millimeters of mercury. Make sure that the pump knob is turned to the right before pumping air to avoid any air escapes. When measuring blood pressure, place the chest piece of the stethoscope below the anterior cubical space over the brachial artery. You want to inflate the cuff about 180 to 200 millimeters of mercury. Turn the knob to the left and release the air approximately 2 to 5 millimeters of mercury per second. The first tab that you hear is the systolic. This is when the blood flows from high concentration to low concentration. The last tab before the sound disappears is a dystolic. This is when blood pressure returns to normal. In this case, the systolic was 108 and diastolic 72 milliliters of mercury. Here's a chart of the blood pressure measurements. You want to repeat this process about 2 times with a minute rest in between each. Thank you.